The United States government spent $6.8 trillion just last year, and there was a budget deficit of $1.8 trillion. Now, Republicans say they want to balance the budget, and they're cutting health care spending to reach that goal. Tonight, our Pennsylvania State Capitol correspondent Kara Jeffers is joining us live with specific statistics, Kara, for the state of Pennsylvania. Kara, what did you find out?
Good evening, Eva. Well, President Donald Trump's big, beautiful bill is still just in the Senate, so this is not law yet, and it's looking to make changes to public health insurance policy, like requiring stricter proof of work for people who are on Medicaid. Now, the government estimates that these changes will push around 15 million Americans off of health insurance, and I have estimates for how many Pennsylvanians could be impacted by that. Today, the Pennsylvania Health Access Network hosted a webinar on federal health care cuts. If changes to Medicaid were passed, around 300,000 Pennsylvanians could lose Medicaid access. If changes to the Affordable Care Act go through, like ending a pandemic-era tax credit, around 270,000 Pennsylvanians could lose insurance they bought on Penny, the state's public insurance marketplace.
Cuts to Medicaid and cuts to Penny will harm every single Pennsylvanian.
Human Services Secretary Val Arkush says when people are uninsured, it drives up healthcare costs for everyone.
When hospitals see patients who don't have health insurance, they have no choice but to shift the cost of the care that they're providing to people who do have health insurance, to the people who can pay. And that translates into higher insurance premiums for private plans and employer-based plans.
Healthcare providers say many Americans could still be eligible for assistance, but that strict requirements are duplicative and burdensome.
There will be a really significant impact to how many extra steps people have to go through to get their coverage, to prove they're eligible when we can already verify it electronically. What we see is that every step you add, people drop off along the way.
The Pennsylvania Academy of Pediatrics has also warned that rising healthcare costs put kids at risk of losing healthcare access.
We need to put the focus back on what's happening with the kids. They're not okay, and we need them to be okay. And
at least when it comes to those Medicaid cuts right now, the federal bill is really focusing on working adults who don't have dependents, so people who don't have kids. However, when it comes to those Affordable Care Act changes, we might just see that health insurance gets so expensive so that even people who do have kids might not be able to afford it on that public insurance marketplace anymore. In Harrisburg, I'm Kara Jeffers, Erie News Now.